Good evening. Welcome to you all. My name is Tendai Gwenhure. I'm the co-lead for the Clinical Ophthalmic Practice programs. We want to welcome you all to this event where we are going to give you information about the programs. So the plan for this evening, I'm going to give a short presentation, then one of the student reps is going to give a talk, then we'll just open it up to any questions that you have. Okay, so I'm just going to share. So if you have any questions, feel free to put them in the Q&A and we'll be able to answer them at the end of the session. All right, okay. Can you see my presentation? Anyone?
Yes.
Yes, Tendai.
Okay, great, okay. So I'm just going to. All right. So that's my name, Tendai Gwenhure, and that's my email address. And I have Anjali with me here, who is the deputy program lead. Okay, so the overview, we'll just introduce you to the education team and we'll go through the program overview. And we'll also talk about the entry criteria for the program and the mode of delivery. And, we'll just also talk about student support that we offer. So the team, that's me, Tendai there, and we have Anjali, who is also here on the call. And we have Fadoza, one of the module leads. She leads the anatomy and physiology module. And then we have Roxanne Crosby-Noby, research and statistics module lead, and Adam Mapani, he's one of the co-leads. And we also have Laura and Grace Annie. So these are the module leads for our programs. And one of the most important people here is Sanam Javid. She is from the education team. So if you have any queries regarding, administrative aspect of the program, she is the key person to email, and the email address is there. All right, so where are we? We are the Institute of Ophthalmology is located just behind Moorfields Eye Hospital. You'll see the green building, so that's the institute. So in terms of teaching, some of the teaching is done at the institute, and some of the teaching is done in the Moorfields premises. So the PG set, I'll first talk about the PG set. So it is a 60 credit module program at level 7. It's offered as a part-time. The program starts in September, ends in June. It has 4 compulsory modules, which are delivered as mixed mode. So I'll go through the modules in greater details. In terms of study time, there are 7 study days in term 1. So term 1 is from September to December, term 2 from January to April to March. So in term 2, we have 7 study days. Now, in terms of, so that's the PG set. Now, it's 1 year. If someone wants to progress to do the MSc, if they haven't done any prior ophthalmic training, or if they haven't done the PG set, they need to do the PG set module in the first year. So the PG set, those 4 modules are core and a prerequisite for the MSc. So MSc is 180 credits at level 7. So like I said, if someone hasn't done the PG set, or they need to do that first. So MSc is offered as part-time or modular flexible. Part-time is up to 2 years. Modular flexible is 2 to 5 years. And the MSc has one core 30 credit module, which is the physical assessment, and that's in term 1. Now, following that, in term 2, one has the option of doing 2 15 credit modules, and the current options are theater, A&E, and glaucoma. Alternatively, they can do 1 30 credit module and the current option is the retina uveitis and oncology. So those are the options. So just to recap, one has to do the 60 credits from the PGCET modules, then 30 credit core from the physical assessment, then another 30 credits, either the retina uveitis and oncology, or a combination of two modules, either glaucoma, theater, or A&E, to make up the 30 credits. So that's 60 credits for the second year. Now, to complete the 180 credits, one will just need to do the dissertation in the final year, and that runs across term 1 to term 3. So those are the modules for the MSc. Now, I will just talk about the entry criteria for both programs. So we want a minimum of 2.2 from a UK university or overseas equivalent standard. And one has to have a healthcare qualification, which could be nursing or allied healthcare profession, and minimum of 1 year ophthalmic experience, and one needs to be currently working in an ophthalmic practice, because some of the learning needs to be done in clinical practice where you work with your supervisor in the clinical area. So one actually needs to be working in the field of ophthalmology. And English language is a requirement only for those people who have not studied, done prior learning in English as in their exams. Now, there are other application considerations apart from that entry criteria. So if someone has done some ophthalmic course, like I said before, they can apply for recognition of prior learning. And also clinical experience. As an example, if someone doesn't have a degree, or someone doesn't have a 2.2, but they have reasonable clinical experience, if they include that in their application, that can be considered so that they can we can apply for suspension of regulation. And the personal statement has to be really strong in your application. And in this, you need to articulate why you want to do the study, either PGCET or MSc, why you want to study at UCL. Articulate your career trajectory, how this program will complement your career plans. So you really need to say why you want to study, why you want to do the course. And references, these need to be professional references with a professional email address, not personal emails. Ideally, your manager or someone from your work. But if you're studying, you could, or if you've recently studied, like in the past year, you could also put, in addition to your professional reference, you could also put an academic reference. Now, delivery of teaching. It's a mix of virtual, face-to-face, and clinical practice. We deliver synchronously. That means scheduled real time where we meet together. It could be face-to-face or virtual. So synchronous, that means we are there together. You students and the lecturers. So we are together at a scheduled time in real time. Or it can be asynchronous. Asynchronous, that means it's in your own time, in your own learning, in your own time. So it doesn't have to be us all together. And some of the learning, like I said before, it's clinical in your own clinical areas. And we also have group work. Some of the group work can be, online, where you're given a task or an activity to do in groups. It's really, really important that, when you allocated group work, you coordinate each other and do the work. And some of the work will be individual, and this could be, a range of activities, presentations or whatever. So this can be varied. Now, in terms of virtual learning, we use the Moodle virtual learning platform. So it just looks like this. So you will have the learning activity, and you will also be able to post your work on Moodle. Right. In terms of student support, there is a range of support that we offer. every student will be allocated a personal tutor who won't necessarily be from the same program. It could be anyone from another program. So that's your source of support. And personal tutor, you can, they offer a range of support from, where to find help, if you have problems with health and well-being, if you have something confidential that you want to talk about. So personal tutors are there to support you. Okay, just bear with me a second. My apologies for that. Okay, so personal tutors, they are there to support. And in addition to the personal tutors, you also have the education team. That's the program team, the program lead, the module leads, the education admin team. So if it's something to do with, directly to do with the module, the first point of contact would be the module lead, or, and also you can approach the program lead depending on the nature of the problem. And we also have the student support and well-being team. And if you have, if you need support, again, talking to your module lead, talking to your personal tutor, they can point you towards the right direction, and the resources will be there available on Moodle. And also more information will be provided on induction. We will have someone from the student support and well-being team to give you a talk in terms of resources and support that they offer. We also have library support. They offer, training on literature search, referencing, and even just general academic skills. They are very, very supportive. They offer one-to-one support. They offer group support, and in term 1 and in term 2, we have scheduled library sessions. But in addition to that, you can also book a one-to-one support should you need it. And you also get peer support. This is from your colleagues from the same cohort group, or from other, groups, or from, for instance, some of our students on the MSc, they do the glaucoma module, which is run by an ophthalmologist. So in their cohort, it will be a mix of medics and nurses. So previously, they've done budding where a nursing student buddies with a medical student, and it's really, really good experience to share and learn from each other. So peers are not limited just to people in your cohort. It could be anyone else studying at UCL. Now, like I said at the outset, the Institute of Ophthalmology, where we are located, is situated away from the main campus, but I would strongly encourage you to go. There's lots of activities, lots of support, lots of forums that you can join at the wider UCL. So don't be just restricted to the Institute of Ophthalmology. So again, like I said before, module leads can offer you lots of support, and we have lots of feedback channels where you can provide feedback. Now, we really value student voice, and we have several channels for student voice. We have for every cohort, we recommend that you have at least 2 reps, and the role of the reps are to represent you as a cohort, gather information from the students, and then feedback to the program or module leads. And every term we have the staff student consultative meeting where the student reps come in to feedback to the chair. What's going good, what's good, what can be improved on, depending on the feedback from their peers. So it's a really, really good role for student rep. And in addition to that, previous cohorts have formed a WhatsApp group, and I'm sure Ariel will talk about it. that was particularly useful during the pandemic, where students kept talking, networking with each other through the WhatsApp group, and also just passing information to each other, it was really, really good for peer support. So that's something that I would recommend that you do once you start, be part of that, so that you can just stay together as a cohort to strengthen that collegiality. So in addition to that, we have the annual student experience survey. This is a wider UCL survey that you will get the opportunity to provide feedback about your experience studying on the Clinical Ophthalmic Practice program. And I talked about staff-student consultative meeting, which happens every term. Now, okay, so, right. So now, if you haven't applied already, what's next now? Please send in your application. Just go on to the UCL website, and you'll find the link and send in your application. The deadline has been extended for all clinical programs to the 29th of July, not June, I beg your pardon, 29th of July. And once you've sent in your application, please check your emails, for any communication from UCL, and remember to check your junk, because the mail can go to the junk accidentally. And we're planning to have a pre-sessional learning activity. So for those, once you've received your offers, in the next few weeks, we'll send you information about, any activities, because we're planning to have some activities before the start of term. And in the meantime, start preparing what you can, things like IT skills, just polish those up, including things like, Word document, how to convert Word to PDF, start looking at, like academic writing skills. Start thinking about what you can start learning about anatomy and physiology. Start being inquisitive in practice. When you see things happening, ask, why are we doing it this way? Why, so start developing that. Don't wait to do the course for you to start, asking that. Now, so that's my presentation. But before we ask any questions, talk more about the program that she leads. So over to you, Anjali, then we'll just open up for any questions. Thank you.
Okay. In the first term of the program, we run PG Cert program, we run 2 modules. The first module we will run is the anatomy and physiology, which is a 15-credit module. The program lead is going to be Ferdosa, and I'm going to be the deputy program lead for that module. That anatomy and physiology is going to be asynchronized. That means it's going to be online. You need to study in your own time. At the end of that module, it's going to be an exam, which is going to be multiple choice question exam. It's 100% multiple choice question exam you need to attend. So that's the first module you will attend in the term 1. The second module you will attend in term 1 is going to be the ophthalmic clinical case study module. In this module, as the term itself is explaining, it's going to be clinical case studies. In this module, you're going to learn about the disease condition. That means the anterior segment disease conditions, as well as the posterior segment disease conditions. So you're going to learn several conditions that affect the anterior segment of the eye, as well as the posterior segment of the eye. At the end of this module in term 1, you need to have an assessment. The submission is going to be 2 assignments you need to submit. One is a case study related to anterior segment disease condition. And second, you need to choose a posterior segment disease condition and need to write about that. All the information, how to write it, which case you can choose it, all those information we will give you once you are in the program. We are there to guide you. So those are the 2 main modules we will run in term 1. Thank you, Tendai.
Thank you very much, Anjali. So you have had an overview of the two modules in term 1. These are modules for the PG set. Now, in term 2 of the PG set, there are 2 more modules. You remember I said 4 15-credit modules. There is, so in term 2, there is the research and statistics, introduction to research and statistics. We know that, we need evidence-based practice. So everyone needs to be really research aware in practice for us to be competent, practitioners. So we have this module, Introduction to Research and Statistics, where you learn basics of research, basics of statistics. And we do appreciate that some of, it's possible that some who did their NEST training prior to 2011 probably don't have degrees, have diplomas, so you have not had that exposure to research and statistics. And we don't want you to be limited by, the fact that you didn't do research, should you decide to go on to do your MSc. So we introduced, we have this introduction to research and statistics so that you have that basic foundation. And in terms of assessment, we, you do, statistics, MCQ, and also an audit proposal. So this is really, really basic research and statistics. So that's the third module. The final module in for the PG set is clinical care in practice. So this is where, you pull everything together, your knowledge of anatomy and physiology, your knowledge of case studies, your knowledge of research and statistics, pull everything together, and I'll talk about how you impact practice, develop your clinical skills, so that you, and what we're trying to do now, you're probably aware of the OPT and OCCF. What we're trying to do is map everything so that when you have done this module, you can actually use the evidence of your clinical skills portfolio as evidence towards your OPT, ophthalmic practitioner training. So you will have a clinical skills portfolio that you use on your clinical days in practice. This is going to be signed by your clinical supervisor. You provide evidence to us that you have been signed for these competencies. You'll be given a list of competencies, which are, again, like I said, mapped towards the OPT and OCCF. So you'll have that portfolio, and you will demonstrate knowledge of professional issues, ethical issues in practice, and how multi-professional working influences ophthalmic care. So those are the 4 modules. So I will pass on to Ariel just to talk about his experience of studying at UCL. Thank you. Over to you, Ariel.
Thank you very much, Tendai. You hear me? Yep. All right. Thank you. My name is Ariel Arel. I'm a PG Dip student under the Clinical Ophthalmic Practice program. Well, good evening, everyone. It is noteworthy to see the presence of prospective people who might be in the threshold of signing in or have already received an offer for the postgraduate study here in UCL for PG Cert or MSc in Clinical Ophthalmic Practice. You're all welcome. I would like to share to you my journey from being a total novice in ophthalmic nursing to now in the process of becoming a Master of Science in Clinical Ophthalmic Practice. Not long ago, when I finished my BSc in nursing degree in 2019 and was given again the opportunity to continue my study at a higher level, which is the postgraduate study. Given my surname Aral, which in Filipino means study, the more I practiced my profession, the more it became incumbent for me to learn more and lead me to take up my postgraduate certificate program in Clinical Ophthalmic Practice here in UCL in 2020. For the continuation of my study, a year after I've undergone the our trust preceptorship program. During that time, we were faced with challenges even from the beginning of the academic year, because that's the time where the pandemic started. However, staff from UCL were helpful and supportive. The program's strength became highly apparent during the COVID-19 pandemic, as its modularity allowed me to effectively manage my time especially when I was redeployed at UCLH to provide additional support. It was a struggle at first, considering the additional workload and the fact that the redeployment took me outside my field of specialization, necessitating many adjustments and adaptation to the new conditions. But I took this in strides, applying my management and organizational skills to the utmost, and used the situation as an added opportunity for learning more, as well as other nursing practices. Now, online consultation, together with access to a wide range of databases of the UCL and ably supported by highly qualified lecturers for postgraduate study, facilitated the learning process. With diligence and perseverance, I was able to submit my summative assignments and other requirements ahead of time, and was able to finish the modules for physical assessment and ophthalmic practice, which was Tendai has discussed. That was the first term, and glaucoma for the second term. The first module honed my skills in making clinical evaluations, while the second module enhanced my understanding about glaucoma related to the etiology of raised intraocular pressure, optic neuropathy, and the different tools and techniques for its diagnosis. When we were allowed to do face-to-face meetings, there were also interesting and reinforcing activities and workshops, such as practicing trabeculectomy, using a dummy eye, after having been taught the types and techniques of surgical sutures. So you see, you will also get to have some fun whilst doing the course. When I enrolled in ophthalmic A&E practice, it enabled me to build up my skills portfolio in handling and managing patients presenting with ophthalmic emergencies. The combination of theory, practice, and application made for a very well-rounded learning experience, and led having me being awarded with PG Cert in Clinical Ophthalmic Practice and with distinction while currently enrolled in the PGD program. I just graduated last 8th of June. That was last week. So one might ask, how has all this study affected me personally and professionally? Among the most important and valuable aspects of the postgraduate study I took was the appreciation of the relevance of the topic in their applicability to real work scenario, which led to a deeper understanding and better insight, which significantly enhanced my observational, analytical, communications, and assessment skills. It helped me build greater self-confidence and be able to work with a higher degree of professionalism. Continually reading and cross-referencing research articles and clinical audits developed my passion for research, which in turn paved the way for the improvement of my writing skills. It was not easy, but now I want to continue my quest for more knowledge and desire to learn more and further improve my skills and potentials. So I am now awaiting to enroll to the MSc program. One of the UCL campaign is paving way to disruptive thinking, which allows the student to think freely and differently from things believed orthodoxically, as this allows for creativeness and the ability to think critically and seek answers beyond and outside canonically based solutions. Such an atmosphere creates a condition conducive to exploration and discovery. This has been proven by the university's numerous achievements and recognition received in diverse fields of practice, resulting from radically different and effective solutions that help solve very difficult problems. So I hope this will inspire you to formulate your next move, and that is to enroll and gain much knowledge here at UCL. Thank you very much. Cheers to all.
Thank you very much, Ariel. So you have had Ariel's journey, and he had the challenge of studying during the pandemic, but he still pulled through and got a distinction. So, and you have heard from Ariel that one of the key things is to manage your own time and to understand why you are doing the course in the first place, because you need intrinsic motivation. So you need to know exactly why you are doing the course. What is it going to add to you, or to you personally, professionally, and in another way? So it's really, really important. And in it all, don't forget to have fun. So time management is important, the relevance of a course to your everyday practice, and going to impact practice? Because one of the things that some managers ask is, some people have done the course, but they've gone back, still have gone back to Band 5, still just doing VA and history. So really, when we have done the course, before you actually come to the course, have a discussion with your manager. Agree with your manager that, okay, I'm going to do this course. You have that discussion. How is it going to improve practice? How is it going to make a change in your everyday practice? So that conversation is really, really important. And it is in that conversation that you can then negotiate study time with your manager. So that's really important because this is master's level study. You really need to take ownership of your own learning. So that's really, really important. I'll just pass on to Anjali to add anything before we open up the forum to Q&A.
No, that's fine. Everything is being covered now, Tendai. So that's fine. We can move to the question and answer section.
Thanks very much. So I'll just go on to the Q&A. So what would be my career after this program? That's a really, really good question. So that conversation you need to discuss with your manager, during appraisal is a good time for you to actually have a conversation with your manager, like what's, your career plans, the needs of the service, and opportunities that are available in your clinical area. So this is what will determine what happens after the program. As an example, if you are in an area where they just need someone to, as an example, where they need someone to do intravitreal injections, you are at Band 5, you are not doing injections. So after that conversation with your manager, you can then say, okay, I want to be to do injections. So if I do this course, then I will have a better understanding of anatomy and physiology, better understanding of research and statistics, and then I can then train to do the injections. So with that theoretical underpinning, you can easily then develop to be a nurse injector. So the short answer to that, this conversation of progress really depends on the nature of where you're working, your clinical area, and the conversation with your manager in terms of the service needs of your area. Can I take this program without any experience or exposure to ophthalmology? So in my presentation, you need to have at least 1 year of ophthalmic experience. So you don't need to be an expert who knows everything about ophthalmology. So in the PG set, Anjali has talked about the first module that you do, anatomy and physiology. We start with the very, very basics of anatomy and physiology. So if you have 1 year of ophthalmic experience, that's okay, you can still apply, and you will learn. We'll start with the basics and build on from that. What you can start doing now is start looking at least how the eye looks like, the structures of the eye, and just so that you have that basic knowledge.
Can I add into that? Because one of the question is, without any experience or exposure to ophthalmology, I think it's better to have the exposure to ophthalmology, because when you are in these modules, what you need to do that you need to be in an ophthalmic setting, then only you will be able to undergo this program. Because if you listen to the second module I was talking about, the case studies, things like that, you need to have that exposure in a clinic. Then only you can learn about anatomy and physiology, you can learn about the anterior segment disease condition, you need to learn about posterior segment disease condition. At the same time, you need to present the case studies. For that reason, you need to have that exposure and experience in ophthalmology.
Yeah, just to add, so the case studies that you'll actually be doing will be cases of people that you would have seen in clinic. And again, the clinical care in practice, you will do skill area with a clinical supervisor. So, during my presentation, I mentioned that you need to be currently working in the field of ophthalmology with at least 1 year experience of clinical ophthalmic practice. So is it possible to have a reading list before the program starts? Yes, we are working on that. You will be getting a reading list. It's just that we didn't send it out because applications are still open. So once it's closed, we'll be sending reading list and some resources for you to keep you busy before you start the course.
Another question, Tendai, is can I go through ophthalmology with an optometry degree, or must I have an MBBS?
So this these programs that we're discussing is Clinical Ophthalmic Practice Program. It's ideally aimed at nurses. We do have an ophthalmology MSc, and we have an MSc for optom. So perhaps you've seen my email in the chat. You can just email me so that I can point you towards the right direction, if that's okay. Yeah.
The next question is regarding students due on September and wasn't sure that they will be admitted for the school year and booked certain holidays. How would this affect the study, and is there any constraints to do this?
So in terms of attendance is really, really important. You need to attend the short days because we don't repeat any session. So once you miss a session, although if they are virtual sessions, we aim to record. If you have planned holidays, if you're going to miss, if it's just one session that you're going to miss, you will need to speak to the module lead well in advance. But ideally would really want you to attend all the sessions if possible.
As Tendai mentioned before, it's a 7 teaching sections for this module for the whole PG Cert. If possible, it's better to attend all the 7, so that will help you with your studies. But in case if there is any holidays booked, as Tendai mentioned, please talk to the module lead, and we will try to accommodate, and we will try to send you the presentation or video link. Can you be an eye surgeon with this MSc?
So like I said, this MSc is ideally for nurses. There is an MSc for ophthalmology. Again, perhaps if I could ask Colin just to put the details of the MSc ophthalmology, the link. Otherwise, my email address is in the chat. You can email me and I can point you towards the right direction.
And next question is, you mentioned about the OPT competency framework. Should we be applying to that at the same time to get dual accreditation, or can this be converted across at a latest date?
That's a really, really good point. At the moment, our programs are not really mapped, against the OPT competencies, for you to get accreditation. However, the clinical skills, because you will have a clinical skills portfolio, those skills that you will do in your areas, some of them are part of the OPT. So that portfolio can actually be evidence for your OPT. You can use that portfolio as evidence for your OPT, but the course itself, at the moment, you can't actually get OPT accreditation from the course, but you can use your clinical skills portfolio as evidence.
Next question, is it possible to have the list of required skills ahead of the start of the program?
Ideally, I would say it's better to give you the clinical skills, at the start of term. At the start of term, where we, give you the assessments and because the clinical skills portfolio is part of the formative assessments. So all the assessments we give you at the start of term. And so that's when we would give you the clinical skills portfolio. Because even if we give them to you now, you can just look at them. Otherwise, we wouldn't really consider anything that you do before the course.
I think while you are in, before even you start the program, start learning the skills in your own department, the basic skills you do in your department. Just start learning that. That will help you. Yeah,
that's a really good point. Don't wait to start the course.
That's just true. Yes. Yeah. Be active. Just participate and just learn now. Start now.
If you can have like a clinical mentor, someone that can help you in your clinical area. For instance, if there's a skill that you're not yet competent at, and there's someone who can do it, buddy with them so that start the learning so that when you do the course, it will be a lot easier.
The next question is, how often do I need to attend UCL in person? I'm based in Ireland.
So at the moment, all the theory sessions are virtual. The only sessions that are currently face-to-face are the clinical practice days. As an example, slit lamp study, slit lamp sessions. But if for one reason or the other you can't, again, speak to the module lead so that you can see how else you can we can facilitate your learning so that you don't miss out.
That's all the question at the moment.
Yeah.
I think there was just one more from Stacey that was in the chat rather than the Q&A, and Stacey has asked, once we apply for the program, when would we know if we have been accepted?
That's a really, really good point. That's a really, really good question. And when you send in your application, try and put as much information as you can, because if there's missing information, that delays the processing of your application. And also, if you have a degree, the process is easier. But if you don't have a degree, again, there are certain processes, certain checks that we need to do, before you can get an offer. So if it's a straightforward application, you meet the entry criteria, you provide all the the required documents, then the application process is easy. It's difficult to put it really a time frame to say how long it's going to take, but because we're just towards the end of the application deadline, we're just hoping that because there was quite a backlog in the past few weeks, but now it's kind of easing off. So we're looking at approximately two to 3 weeks, but it's difficult to say exactly what, because our admissions office is central admissions office, so they deal with all the other applications, not just applications for this program. So the short answer is, if you meet the entry criteria and you have submitted all the documents, then that makes it easy to process your application. Any other questions?
No, I can't find any more.
So in terms of when you are processing the application, but there's also a delay, because when an application is processed, like I said, it goes through different processes, and it needs to go back to admissions for them to send you the offer letter. So there may be a further delay even when you have been accepted on the program. It doesn't mean you are accepted and you instantly get the offer. It still takes time before you get the offer letter. So the message is, make sure that if you miss the entry criteria, and if you don't meet the entry criteria, put as much information as you can in your supporting statement, so that you may be able to have suspension of regulation, so that you are accepted on the program. Make sure that you have your references in, and they have professional emails. You have the right references, professional references, or if an academic reference, then an academic reference. So if there's anyone who has been waiting for their application for a long time, have not had any response, please just email me and I'll be able to look into that.
Hi, Tendai. Can I ask a question?
Of course you can.
Is there a tentative date already of the start of the first term?
Good question. So the induction, I'll pass that on to Sanam, since that Sanam is here.
Thank you, Tendai. Hello, everyone. Hi, Ariel. So induction, which we hope all students who hope to join the course should attend, begins from week beginning 26th of September. So that's induction week. There'll be a specific date and time. We'll let you know closer to the date when there's an induction for COP students. And then teaching officially begins from week beginning 3rd of October.
Thank you.
I'll pop in the chat a link to UCL term dates. Hope that helps.
I think one more question regarding exactly the same thing. Do we know what day of the week classes will be on, just to plan cover for my clinics? So
I would say, if you, Sanam, you can answer that, because if anyone requires the, you can, I'll pass that on to you, Sanam, regarding time.
Thanks, Tendai. Hi, Monica. I can see that you've posted that question. If it's okay, I'll get back to you separately outside of this session today.
Any other questions?
No, I can't see any.
All right. So if there are no more questions, Anjali, Sanam, Ariel, and Tim, if there's anything that you want to add, you can just talk, then we can close this meeting. Anything, Anjali?
No, we have covered everything. Is there any queries about the program or about the module? Do we need any further information, which we are happy to do that with this 10 minutes time?
I'm just mindful of the fact that we have a mix of people who have applied, those who have had offers, and others who have not applied. So just to say, you will have a UCL induction, and you've seen the dates from Sanam. And following the UCL induction, you will have a program induction just at the end of that UCL induction, where we'll meet for about an hour or two, just talk about the specifics of the program. This is where you get to meet the program leads, then ask questions that are specific to the program, specific to the module. And this is where we'll provide you more information regarding the specific modules. Otherwise, if anyone has any questions, you have our email addresses. Just feel free to reach out to us. If there's no more questions, I just want to thank you all for attending this evening. If you come up with any other questions after this session, feel free to just email us. And again, if you have not received a response regarding your application, please just email us, and we'll be able to chase this up and get back to you. Otherwise, thanks once again for coming, and we really, really look forward to seeing you in September. And thanks everyone for attending. Anjali, Ariel, Sanam, Colin, and Rosie, thank you so much for your support. Thank you.
Thank you.
Thank you.
Okay. All right, bye-bye.
Bye.
Thanks, Colin.